Hi. So vaccination is a political hot button right now. The head of the CDC was recently fired by President Trump over a disagreement over vaccination schedules, and people are polarized. They're upset on both sides. I never really understood the controversy until now. Now that I looked into it, I think I understand why people are upset. Uh, so I did look into it. I made this video. It's largely about the harmful effects of vaccines. I'm not, I'm not saying we shouldn't get vaccinated. I'm not at that point. But I do want to discuss the side effects, the unintended harmful consequences. Well, I used AI to collect some of the details about these old vaccines. And so, if you want to nail everything down, check it against the original sources. However, I'm sure that the big picture I paint is quite accurate. Concerns have been raised for decades. The other day, I published a YouTube video about Wakefield, one of the first anti vaxxers, and his work, uh, which was discredited. Uh, but that's not the end of the story. Uh, I'm not going to give you an unambiguous black and white opinion on it. My goal is to present especially the facts of biology uh, based on science, not the facts of or the ethics of clinical practice. I'm not going to be talking about what doctors should or shouldn't do. I'm just going to be talking about what I understand the body does with and without vaccines. Okay, I'm going to report several confirmed historical incidents of harm caused by vaccination. I'm going to have to explain the immune system, which is not an easy task. Okay, how are vaccines intended to work? Well, the bodies of any mammal, including human beings, they contain a vast distributed array of cells, molecules, tissues, known as the immune system. A lot of it is in the blood, but a lot of other places too. It may be helpful to think of the immune system as a sort of a computer that can be taught or programmed to behave in a certain way uh, by by its interactions with the environment, which includes vaccination. Vaccination is, the vaccine becomes part of the environment faced by the immune system. The immune system is highly reactive to stimulation because its job is defense. It's supposed to be defensive and reactive. It's defense against infection and cancer in some cases. So it tends to respond variably, almost inconsistently, and it can even attack the body, the healthy body, even without vaccination. There are a lot of autoimmune diseases, some of which are fatal. Okay, when an immune response is too vigorous, this is called overactivation, and it can be triggered by vaccination. Uh, it's not the only way it happens. Okay, the first harmful vaccine I'm going to talk about is the 1960s RSV vaccine. RSV is respiratory syncytial virus. It's a virus that gets into the lungs and it causes the cells to fuse together, completely disrupting their structure, and they don't work worth beans, and the person might die because they can't breathe. They can't get oxygen to the tissues. RSV then is a lung infection. Now, this vaccine of the 1960s was given to children, and they were okay after the vaccination, But later, some of them got exposed to the virus, the disease-causing virus, and the immune system in some cases didn't respond as planned. Instead, the children had like lung and airway changes that made breathing difficult or ineffective. Many were hospitalized, and there were 2 deaths. As a result, this vaccine was abandoned in clinical trials, so it was never used by regular doctors treating patients. Another harmful vaccine was the dengue virus vaccine. It's a similar scenario, but this time the vaccine was widely administered clinically for about 2 years before the harm was recognized. Uh, I couldn't find comprehensive mortality statistics, but one agency recorded 62 deaths. Another harmful vaccine was the influenza or flu vaccine in 2009, the pandemics vaccine. It directly damaged the brain, producing narcolepsy, sleep attacks, a permanent condition of narcolepsy. This vaccine was administered clinically, routinely, by ordinary doctors. Between 2009 and 2010, it was given to about 30 million people, resulting in about 1,300 reported cases of narcolepsy. Well, that's about 1 in 20,000. So there's a trade-off. Among people who were vaccinated, there was a fourfold, in addition to the 1,300 cases of narcolepsy, there was an increase in something called facial palsy, which is, for example, Bell's palsy, weakness and or pain in the face or the eyelids, a ninefold increase in convulsions, compared to the general population, compared to unvaccinated people. It's not actually known that these deaths were caused by the vaccine. They could have been coincidental. This is similar to the scenario that the early anti-vaxxer Blakefield proposed decades ago. That's the topic of my other vaccination video. He speculated that a certain vaccine, the combined measles, mumps, and rubella vaccine, triggered sudden and lasting speech and communication impairment in children. His work was discredited, and I discussed that in my video. Finally, the contemporary COVID vaccines, Moderna and Pfizer. About 1 in 15,000 vaccinated persons experienced myocarditis, that's inflammation of the heart muscle, in some cases long after vaccination. Myocarditis produces pain, shortness of breath, heart palpitations, fatigue, may produce fever, and it generally goes away. The damage to the heart muscle is so slight that no weakening. It's easy to measure the strength of the heart, and no weakening is detected. So these vaccines continue to be used routinely. Now, how did this harm take place? There are a number of ways. Vaccines produce permanent or long-lasting changes in the immune system's behavior. I mean, that's what they're supposed to do, but sometimes the changes aren't exactly what we want. Vaccines are intended to train the immune system to recognize and destroy viruses, bacteria, tumor cells, and anything foreign. Harmful organisms or lifelike viruses that invade the body and produce sickness and death. These are the intended targets of the immune system. The first harmful vaccine I mentioned, the RSV vaccine, overactivated the immune system. That is, the system's normal activities, such as white blood cell infiltration, edema, inflammation, there's too much of it. It can block airways and interfere with breathing. The COVID vaccines that we use now can also activate the immune system, overactivate it. It's quite rare. Uh, Now, the regulation of the intensity of an immune response is, well, it's extremely complex and variable because the immune system is uh, evolution led it to be reactive, defensive, vigilant, always looking for an excuse to go off. Now with vaccines, sometimes the vaccine doesn't quite get the attention of the immune system, and they use uh, auxiliary compounds called adjuvants that are included in the dose to kind of wake up the immune system and get it to pay attention. I discussed this in the mechanism of influenza vaccine harm. Uh, the molecules of the immune system, antibodies, they're structurally or geometrically matched to the target virus or bacterium or to structures on those cells. They generally trigger destruction of the invader or tumor. However, there are non-neutralizing antibodies that don't trigger a defensive destruction of the invader. In fact, they can actually enhance the entry of the virus particles into the cells, uh, leading to severe infection. Uh, this is what happened with the dengue vaccine. Uh, the 2009 influenza vaccine, that's the one that produces narcolepsy in some cases. Uh, it's molecular mimicry. The activated immune system sees the normal, there's a neurotransmitter in the brain called orexin that keeps us awake. Uh, and it unfortunately is similar enough to the influenza virus that the vaccinated immune system can attack the orexin producing cells, and then the person has trouble staying awake. That's one possible mechanism. The second possible mechanism is that these adjuvants, these substances designed to get the immune system's attention, maybe were just too strong. Once again, leading the immune system to attack normal tissue. Okay, how do we prevent this? This is a topic of basically another video, but I want to mention one. Uh, the contemporary COVID vaccines are called RNA vaccines. RNA is genetic material. It can be double-stranded or single-stranded. The vaccines use single-stranded DNA because the cell destroys it quickly, so that the immune response is transitory. It only lasts a few days. The immunity lasts a lot longer, but the processes of change only go on. The learning only goes on for a few days. So this is one strategy to avoid or limit overactivation. Finally, I'm going to come to what is really the crux of the matter, at least as far as the emotional charge, the ethics of vaccination. I've just discussed at great length vaccine harm. However, if we avoid vaccines widespread, this can have far-reaching consequences, large increases in disease prevalence, because if 1% of the population has the disease, then very quickly the others might get it too. Diseases are contagious. So we have two kinds of harm from vaccination and harm from not vaccinating. And these two kinds of harm have to be balanced. It's sort of what you'd call a moral calculus or an ethical calculus. Historically, the government has sadly not involved the general public in these decisions. They've just said, in a paternalistic way. We know what's best for you. Take it. This is almost certainly the reason why so many people are pissed off. Uh, Now, to remedy that, we would kind of have to empower the general public to participate in the decision, and that would be difficult given that immunology is pretty much opaque to non specialists. Uh, so it's an educational challenge, but it's imperative. Uh, so that's my 2 cents worth on the ethics of vaccination and some of the biological processes. Thank you for listening. Good night.